Good morning, and the wheels do indeed keep turning. It's around 9 o'clock, so you know it's time for Lovebabz, Lovetalk. I am talking this morning, and I have a guest in studio. I've got Frances Padilla, the president of the Universal Healthcare Foundation of Connecticut, and she's here to talk about some of the work that they are doing. But I know, Frances, because we go way back, girl, when you were at the Community Foundation of Greater New Haven.
Right. That's right.
And we reconnected because we're on the Planned Parenthood of Southern New England board.
Yes, we are.
So I'm impressed with the work that you are doing. It is nice to see you. Good morning.
Great to see you. Good morning, Babz. Glad to be here.
So let me tell you a little bit about Frances before we frame out this conversation. So she's held various leadership positions in the organization since joining the foundation in 2004. And in addition to spearheading the foundation's research and policy initiatives, which led to the design of the landmark Sustained law in 2009 and policy initiative with building block health care reform legislation passed in 2011, her career in philanthropy began as a program officer at the Hartford Foundation for Public Giving and over 30 years, and then she held positions at the Community Foundation of Greater New Haven before running her own business, New Paradigms Consulting. So tell me what Universal Healthcare Foundation of Connecticut does. Start there.
I will start there. Universal Healthcare Foundation is getting ready to celebrate our 20th anniversary next year.
Wow. Okay.
And it has an interesting history. It really is. It's a charitable foundation that came about as the result of a lawsuit settlement when a number of activists in the labor movement and in the faith community and other champions for healthcare reform and universal healthcare urged the state to file suit because Anthem Insurance Company was buying up Blue Cross Blue Shield of Connecticut back in the 90s.
I remember this.
Yeah, and there was no charitable foundation being left behind to give back to the state of Connecticut some of the value of that nonprofit tax status that the Blue Cross Blue Shield enjoyed. But more importantly, it was really because the Blues, right, are among the last nonprofit health plans.
Mm-hmm.
And by buying up Blue Cross Blue Shield of Connecticut, Anthem was essentially shutting down the nonprofit world of health insurance. And that had significant significant repercussions and ramifications is the word I'm looking for affordable health care.
Okay.
And in the 20 years since, we have seen, and it's not just Anthem, it's United, it's Connecticut, it's Cigna, it's Aetna, all of it. We have seen the cost of health care really rise, and the industry is the insurance companies, the hospital industry, and the pharmaceutical industry.
Mm-hmm.
And the three are really the players that dictate the market, and the consumer is left behind.
Okay. Because when for-profit entities buy nonprofits, they've got to be accountable to their stockholders.
That's right.
So it's not so much the cost of healthcare is so expensive. Is that they got to return it? They have to return investment on the dollar.
Exactly right, and they're driven by quarterly stock market expectations,
mm-hmm.
and the insurers, don't keep the same people for a long period of time, so they don't have the same vested interest
mm-hmm.
in helping members stay healthy. Right?
Oh yeah, no, they're not in the healthcare business.
They're not in the health business necessarily. That's right. So our foundation really came about,
mm-hmm.
and from its inception has been pretty activist, which kind of distinguishes us too from other foundations, certainly from my days at the Hartford Foundation or at the Community Foundation for Greater New Haven,
Mm-hmm.
where we were trying to make change, social change, but we were much more responsive. And even when we were taking initiative, we weren't operating in the public policy arena. The Universal Healthcare Foundation, from the beginning, to the credit of the board of directors, has always said, felt that it needs to be active in the policy arena. Because
So that means you all have to lobby legislators to say, listen, we need you to pay attention
absolutely.
to healthcare inequities and the cost of that.
That's right.
Okay.
We believe government has a role
Mm-hmm.
in protecting consumers, and we advocate and lobby. There are two different things, and we don't lobby every single day of the year, every year, But when we have to, we do. To urge our policymakers to protect consumers and protect the health of consumers.
Mm-hmm.
Yeah.
And so, how do you arm yourself with information? Because you sent me some stuff, and I know there was a study or a survey.
Yes. So we do research. We don't do primary research. We're too small for that kind of thing. But there's a whole national body of research, think tanks and organizations. And the information I sent you, actually, it comes from a household survey done in 2018
Mm-hmm.
here in Connecticut by an organization called Alterum Value Healthcare Hub. And they approached us. We had some pre-existing relationships, just as we try to connect to what's happening with national organizations. And they said, we've got some funding from a national foundation to do some household surveys in a few states, and we'd like to do a survey in Connecticut. And we were like, yes, absolutely. No one ever picks Connecticut. Everybody thinks everything is just fine and dandy.
I think you're right. I think it does have that reputation of, it's a rich state and there are no problems.
There is a perception that Connecticut is affluent and Connecticut has no problems. It can solve its own problems. And the fact that Connecticut is really 2, 3, 4 5 different types of state.
I'm glad you said that.
It goes unnoticed. But Alterum approached us and we said, yeah, definitely, we'll work with you. We'll and affordability is something that we have picked up and raised on our radar in the last decade, because even though the Affordable Care Act made a big difference in the number of people covered in Connecticut, and the sustenance bill that you mentioned earlier from 2009 and 2011 had been intended to really close that uninsurance gap that we had in the state, because we had 10 to 12% of people in the state, and people of color disproportionately represented among that 10 to 12%. But even with implementation of the ACA, which Connecticut wholeheartedly endorsed, we expanded Medicaid. We got more individuals covered through the Access Health CT marketplace. The rising cost of healthcare, the underlying price of hospital costs and drug costs, translate into higher premiums. And those premiums, and the insurance companies, as you noted so well, driven by Wall Street expectations, every year when they request increases to their rates to the Connecticut Department of Insurance, those rates were increasingly double digit. And, they blamed the ACA. A lot of folks blame the ACA. But when you pick up the hood and look under it, you really start to understand what the problem is. We have extremely variable healthcare costs in the state. So a colonoscopy in Greater New Haven could cost 7 times more than it might cost in, North Central Connecticut.
Wow.
And no rhyme or reason. You couldn't understand it. And even as a consumer, if you wanted to go to some website and really figure out who's got the cheapest colonoscopy in the state, it might not be that easy to find out. And people equate costs with value,
Yes.
So there's
this must be the best because it's so expensive.
The consumer has to be more educated, right? So that and the consolidation of hospitals. I don't know if you've noticed in Greater New Haven.
Noticed? We got one hospital now.
We've got basically we have basically 3 systems, 2 of which are the big elephants in the room:
Yeah.
Hartford Healthcare and Yale New Haven Health.
And I'm sure they're going to get married at some point.
Well, oh God, I
Watch.
don't know.
I'm convinced. I'm sure they're dating now,
But
right?
the costs, of those consolidations are justified as helping to achieve economies of scale and all of that.
But that's not true.
And it really isn't. Costs do increase. And, not only are the hospitals being merged, but or affiliated, as the word might go, but so are the doctors' practices. And so Connecticut used to be a state of a lot of small practices, like from 2, 3, 4, 5 doctors as a practice, to now the big hospital doctor practices like Northeast Medical Group,
Okay.
which has, I don't know, 250
Wow.
doctors.
So
Practices.
So this is a trend that's staying with us.
Yes. And then drug costs continue to
Oh my
increase too.
God.
And we all know, the highest profile stories about the EpiPen, but insulin has been on the market for 100 years.
Yeah.
And still there are people today who need to take insulin whose costs have risen so significantly that they're, dividing their doses.
That should be a crime.
It should be.
Like,
I
that
agree
should
with you.
be a crime to
I
sort
agree.
of, because
Yeah.
the folks that need this are very vulnerable. And how is that different than like committing that's a crime, I think.
Well, it really requires a lot more accountability, transparency and accountability. And so one of the things that we've done at the Universal Healthcare Foundation is to focus on trying to get the state of Connecticut, the legislature and the state government to really start holding these players to account. And it's tough, because this is a very powerful group of industries, and and we're not the only state. Other states are as well trying to do these things, and it's very interesting how many of these laws that are passed end up in being challenged in court. But that shouldn't deter us, because what it tells us is that they understand that there is a significant problem. And I gave testimony this year on a bill that we're championing to establish a health plan that would make more affordable coverage available to small businesses with fewer than 50 employees.
Yeah.
This group of businesses.
Because I work for a business that's small.
Yes.
And they do not provide health insurance.
Right.
Because they can't afford it.
They can't afford it. And, we're in partnership with another organization called the United States of Care, and they sponsored some focus groups recently, just last week, of small businesses in Connecticut. And just like our survey, the survey that we partnered with Alterum on, the people in Connecticut are saying cost is a problem, affordability is a problem. We're making, the kinds of choices of not going to the doctor because we can't meet our deductible, that high deductible health plan, or not filling the prescription, or taking half the pills. Right.
And that puts you in harm's way.
And businesses, right? Of course it does. It makes it worse. Then you end up in the emergency room.
And then you lose time from work.
And it costs more.
Yeah, yes.
In the end, that all of us end up paying. And these small businesses across partisan lines, this is the other interesting thing, both the survey and these focus groups across partisan lines said, government's got to do something. We don't see government doing anything, but government has to do something. And for small businesses, some who offer coverage say, every year I sit down, and first of all, it's so complex and so difficult to navigate, and there's no way to predict what the increases are going to be. I'm afraid, so some businesses give their employees some money to go buy coverage on their own. And other businesses offer the coverage and, sort of inch year to year to figure out whether they can keep offering it. It's driven businesses to offer these high deductible health plans. So, an individual could have a deductible of $3,500, and a family can have a deductible of $15,000 before they
oh my God
get any coverage.
So you have to meet that before you even
right.
Right. But who can do that?
Who can do that?
Not if you're working for a small business, you can't do that.
Exactly right.
Wow.
And then for individuals, the Affordable Care Act provides subsidies, right? So, You can go to Access Health CT and you
Yep.
look at the different the different plan tiers, bronze, silver, gold. And if you qualify for subsidies, you can receive a subsidy to help you buy something that you deem both affordable and that meets your needs. Well, that's become increasingly more difficult. And for people that don't qualify for the subsidies because they earn too much, but they still can't afford the care,
Yeah.
they
That's
are
terrible.
really screwed.
Yeah.
The United Ways of Connecticut have, the United Ways of Connecticut have a study that they do every few years statewide. And what they do is that they document the number of people in the state who, as they call it, are asset limited, income constrained, and employed. They call it
the working poor.
Alice study is what they call it, Alice. And it's amazing. There are people who raise their hands and say, I'm Alice, in every town and city in this state.
Oh, I'm Alice. Right? I mean,
yeah, my daughter is Alice.
That's a real thing.
It is a real thing. And so those very people, they don't qualify for public programs, they don't qualify for subsidies, and they are working and they may get coverage, but they can't afford the coverage. So some people have the coverage just in case, but don't actually use it. And some others, they decline it or don't have it. Like your employer doesn't offer it.
Yeah.
So that's really like in 2019 in the United States, in the state of Connecticut, let's think about that. And we're not alone, right? I
expect this to be the conversation in Mississippi, Alabama, and those kinds of places, honestly, because they have a whole different mindset about denying people access to everything.
There.
So,
yes.
So when I'm in Connecticut, which I think is a progressive state, and we have a Democratic governor, I mean, the whole thing. And then we have people here who can't even get health care.
So we're looking, we're this session in the General Assembly is really interesting and filled with some very promising opportunities. I don't know if they'll play out because the political process kicks in, and for every hour I might spend lobbying, the industry spends like 18 times, whatever.
Yeah.
And there's a lot of pressure that they apply.
And they come with gifts.
Yeah.
You don't got no gifts.
Right. So but the bill that there's a couple bills that we're working on. One is around prescription drugs, and we have an independently elected state comptroller. I don't know if you are aware.
Yes.
Just like our state attorney general and our secretary of the state, they're independently elected. And so Kevin Lembo, the state comptroller, who happens to live in our region here, he's from Guilford, he runs the state employee health plan. And as an employer, the state of Connecticut negotiates on behalf of almost 250,000 active employees and retirees. And so that gives them a lot of negotiating leverage.
Yeah.
And Comptroller Lembo is looking to use that leverage to benefit other people.
Wow.
And
that's progressive.
Outside of employees and the retirees, right? And a few years ago, there was a bill passed to establish that opportunity for municipalities. So municipalities could buy into something they call the partnership program, and be able to get insurance for their municipal employees and Board of Ed employees. And that has been building gradually, right? So what he's proposing now is to use that negotiating leverage to do a few things. One bill would have would create the ability for businesses and individuals to buy get their prescriptions, buy drugs at the rates that the state negotiates.
Wow.
So that I think would be really good. And like for the individual, like you'd get a card and you have this discount card sort of, and you go to CVS or you go to Walgreens, whatever, and you can get your insulin at the rate that
the state employees and other people get.
Do, right?
Okay.
So that's one bill. And the other bill would actually do similarly negotiate on behalf of everybody, so that small businesses with fewer than 50 employees could in fact get coverage through a plan.
Okay.
And then part of that bill also looks at extending that benefit to individuals like the Alice folks that I was talking about before. So if you wanted to buy your coverage through a plan offered by the state, that would allow you to get more affordable coverage, and because you're not eligible for subsidies in the Access Health marketplace, then you could do that. And so we're working on that, and there's a lot of interest. There's some really great.
I was going to ask you, what are the legislators saying? Well, I mean, because I'm sure you have to bring them up to speed on how this works.
Well, I will say that the Insurance Committee, which is where all of this stuff kind of starts, the Insurance Committee co-chairs, Matt Lesser from Middletown and Sean Scanlon from Guilford, have been working closely with Kevin Lembo, and they are fully behind this. They're the authors of the bill, of both bills. In the Labor Committee, the co-chairs of the Labor Committee have another bill that's similar, related, and it would benefit small businesses. And the co-chairs there are Robin Porter, right from here,
who is my good friend,
and Julie Kushner from Danbury, who's a new senator.
Okay.
And you know, there's also, I would be remiss in saying that another part of what needs to happen continuously is that we have to keep our eye on the Medicaid program, because given the state budget crisis, one of the places
that they're considering
everybody goes to first is the Medicaid program,
the vulnerable population.
Well, yeah, you know, when the ACA passed and we began implementing the expansion, we already had eligibility for people up to 185% of poverty, and we were able to expand to 200%. But we've been rolling that back, and the people most affected are adults, single adults without children, and they're the most affected. But last year, so in 2017, there was a big legislative push to take out, I don't know, another 13,000 people. They had already removed, you know, quite a few people the year before. And last year, that effort was rolled back through advocacy, because there's a lot of organizations that work together. There's a group called the Medicaid Strategy Group, and then there's also a partnership called Protect Our Care Connecticut that we helped to create. We convened, and it's a lot of different types of organizations, faith organizations, statewide advocacy organizations.
That is good to hear.
Yeah,
that really is good to hear,
really
because
important.
I don't think the everyday citizen knows that there are these forces out there working.
Well, I will say,
on this effort,
if people go to protectourcareconnecticut.org, you can sign up as an individual to get alerts and to
I'm going to do that,
stay up to date on what's going on. You can come to the foundation's website, universalhealthct.org, and also sign up there. There's a lot going on, and you're right, a lot of people don't know about it. So I do want to say that May 1st, we're having a healthcare action day at the Capitol, and we want to turn out a lot of people to let our policymakers, you know something's got to happen.
Yes,
something has to be done. These bills are important, and these issues are important, and it's a problem that needs root cause solutions.
Yes,
we got to get at the issues of price and cost and coverage, because even though we have the ACA, and we were, embraced it really early and got a lot of people covered, we're starting to see losing some ground.
Wow.
We're starting to lose some ground.
Ooh.
So it's very important that our policymakers, who are faced with all kinds of decisions that they have to make on a cross section of issues, and the budget being such a priority, right? our policymakers, the governor's office, they all need to know that we're all out here, you know, and we got to stay present. So we're trying to turn out, you know, at least 100 people, at least 100 people to come and, you know, spend the day, talk to their legislators, and exercise your right as a citizen of the state, right? A resident of the state. This is the democracy we live in, and this is part of the process.
I think you're absolutely right. So talk a little bit. So what do you hear on the national level? Like, what is the conversation like? Because I know that you have to be plugged in to what is going on in the rest of the country. So talk a little bit about what you're hearing. Who's jumping out there doing some innovative stuff around this? You know, who do you like? Oh, you know what? We could pull some of that into Connecticut, or, you know, and who is absolutely like not doing anything about this?
Well, I will say, you know, there are other states. California is usually ahead of everybody.
Yeah.
We jokingly say the Republic of California, because they could kind of do their own thing almost. So, you know, they've passed some bills around pharmaceutical drugs. And they have had a number of bills that haven't yet succeeded to establish a single payer system. And some people talk about a single payer system. You know, single payer is a sort of a term used to refer to a variety of different things. And I think it's important for everybody to understand that we're not talking single payer in Connecticut, but single payer.
And what does single payer mean?
Yeah, thank you for the question. Single payer essentially means that you have one payer, and that payer is government, usually the national government. That's what Canada has. It started, though, in 8 provinces of Canada when they began. They didn't start it nationally all at once. They started and then they expanded. They pay, so their tax dollar goes for health coverage.
Something is on fire or something out there.
Something in the background here.
I'm sorry, because I'm like, it's going on and on and on. I was trying to ignore it, but I was like, Jesus.
Well, we're good. We can stay on focus. And then other countries like England has a national healthcare system where they run healthcare.
And they run it, and they know they run it at a loss, right? They know that they don't care.
Well, they do.
I mean, but they're not. But they still do it, right? Like they don't say.
Well, it's their values.
Yes,
it's part of.
That's
their
my
values.
point. Like that's their. Like we know, but this is what we have to do.
I heard a German economist speak at a national conference a few years ago, and he talked about this issue of values and how other countries ensure.
Because France is the same way, right?
Yes,
France, England, yeah.
Japan has a national health care.
Some of the Nordic countries.
But I want to specify that to the best of my knowledge, only England actually provides health care through the government. The other countries ensure that their citizens have coverage.
Oh, that's interesting.
Right? And in some cases, like Germany, there's insurance companies, but they're regulated. They're regulated. They're told how much they can, you know, where they cap out. And then they have, you know, subsidy programs for the poorest of the poor and all of those kinds of things. But the national government sees itself as having a responsibility to ensure that everybody has the coverage and access to quality care. The U.S. is really unique among the developed countries in that we prefer to take a free market approach to healthcare, and we think of health markets, right? And some health markets are more profitable than others. So, you know, money gets driven.
And we're back at the money conversation.
It is about money. It is about money for sure. So what's happening in other states, just to get back to your question, is that they're experimenting. They're trying to experiment through the legislative process to improve, address affordability of health care, and to improve access, and also to improve equity. We haven't talked about that because equity, you know, when these reforms happen. Sometimes the people that need them most don't actually benefit.
Right.
And having a card, just like I said about, high deductible health plans or even the coverage you get through Access Health, having a card alone might not get you the access that you need because you have to spend too much money that you don't have. Then the other issue has to do with the quality of care. Who will accept Medicaid? Who will accept your plan?
Do you think we're good here in Connecticut about accepting Medicaid? Are we better? I mean, I'm just trying to get a sense of.
I think that we're not. We're fine with lots of room for improvement.
Okay.
I think our state Department of Social Services, our state Medicaid program, works very hard at that, and we have good access to primary care. Where we don't have good access is to specialists.
Okay.
Because specialists feel that the Medicaid program doesn't reimburse adequately, and the state has to keep reimbursement rates at a certain level in order to keep the program affordable. You know that over 750,000 people in Connecticut participate in Medicaid, and that's
a lot of people.
That includes disabled, elderly people, poor people. There's a lot of people that qualify for Medicaid in Connecticut. And back to our early initial, conversation about there's so many different Connecticut's that folks don't understand. And so access to specialists is a challenge and one that we have to deal with. At the national level, as in Washington, D.C. and Congress, what we see is continued interest in repealing the Affordable Care Act. And they have no ideas about substitution, what would come in place of the Affordable Care Act. I will say this, 20 million more people have coverage today than they did 10 years ago.
And they cannot in good conscience kick these people off. And people, they can't.
And people won't take it. I mean, imperfect as it is, it's better to have what they have.
And
right?
there are people who, well, like when I listen to the folks in West Virginia, coal miners and those folks who never had health insurance ever until the Affordable Care Act. Right. And to tell these people, oh, now we're going to undo this, right? And some of them didn't even, like, I think West Virginia didn't even do the Medicaid expansion.
Right. No, the southern states, Kentucky expanded. The southern states have resisted expansion. They have.
And this harms their people. Because these are the poorest of the poor.
Cutting off your nose to spite your face.
Yes. And I'm like, how do you stand in front of people and tell people, we can't cover your kids, we can't cover you, we're not going to, and if you enjoy, I mean, that seems to be unconscionable to me. And it seems un-American.
Well, I think, what we're hearing too, right, when you tune into the national news and the plethora of candidates that are presenting themselves.
It's like a pageant now. The American presidency pageant.
There's more and more talk, though, about healthcare than there's been in the past, and about using something like the Medicare program to expand coverage to everybody. And there are multiple proposed ways of doing that that we try to stay educated about. And so I think that that's going to be very much part of the presidential. I
mean, do you feel hopeful
debate,
with this group of candidates that they are already having these conversations about healthcare? I mean, because it's early, but you're starting to. I mean, they're saying it. So, do you feel hopeful? Does that make you hopeful in the work that you do? No. I'm not overly optimistic, but because I think it's a lot more complicated than some people make it seem. Okay.
I will say that the American people are speaking.
Okay.
And the 2018 election said, healthcare was part of the 2018 election, and candidates were forced to talk about it. And I mean, with the exception of a couple of the current folks that have presented themselves who've been talking about it for a while, I think that they're all forced to deal with it. And so I think the American people are tired. The survey results in Connecticut are not unique. Kaiser Family Foundation is a national foundation that does household polling every year. And what was striking was just how in sync with the national we were here in Connecticut.
Wow.
Nationally, the households are saying, we're getting tired of this. We can't take this anymore.
Mm-hmm.
Can't take it anymore.
And then, this whole notion of pre-existing conditions is quite challenging, because I don't know anybody who doesn't have a pre-existing condition these days after a certain age group, right? After you reach a certain age, I mean, diabetes, heart disease, whatever it is.
I think that if you asked me what was the most important thing from the Affordable Care Act, I would probably say that was it.
I think you're right.
That it opens up a door to that can't be closed again.
Yeah.
I think that it would be,
because
really
otherwise
difficult.
people would just be waiting for their end, right? Because they couldn't.
Well,
I remember when I left a big paying job and had health insurance, and then when I got divorced, I didn't have that anymore. Like, I couldn't keep up the COBRA, and so I went to some of the insurance companies on my own and said, "Oh, I want to do this," and they were like, "Well, you have pre-existing this, that, and the other thing, and you have to do this, and we can't," and da. And I remember thinking, "Oh, what am I going to do?" And then here comes the Affordable Care Act, and now people have to deal with me.
Well, it's my husband and I had a similar experience, self-employed. Both of us were self-employed, and we went for health insurance, and we were denied on the basis of a pre-existing condition. And we were like, holy moly, what are we going to do?
Right.
And then, interestingly, is this how the system works? We get approached by one of these association health plans based in Texas or something like that. This was back in the early 2000s. And those plans can't sell in Connecticut anymore. We don't allow them to sell here. But for about 2.5 years, we were just basically paying premiums that covered nothing, because we were afraid that in a catastrophic situation, that we had nothing.
Yes.
And I went to work at the foundation in 2004, and for the prior decade, we were sort of piecing and patching insurance that way. And
and if, like, you're doing that,
and you know what happens, right?
It's amazing.
Small businesses are the backbone of the economy. There are 700,000 people that work in small businesses in Connecticut. And back then, I don't know how many there were, but small businesses say, look, we know we could grow, we could expand and take our business to the next level if we were able to hire more people. We're afraid to, expand because we can't attract people without coverage.
Yeah.
And the bigger companies, that's part of what they are able to give to their employees. And so the ability to grow business. I mean, here in New Haven, we have a lot of businesses in the community that probably could grow, businesses that could start, people that could leave wherever they are now and start their own enterprise, who don't, because they're afraid and they need their health care.
Yeah. That's a very good point, because nobody wants to go to a job these days without, some basic, not even basic, better than basic.
Well, if you have a family, if you have any kind of chronic condition.
Yeah. And that could be just about,
it could be anybody.
Yeah.
It can be anybody.
Yeah.
And we get a lot of stories. And I will say this, we are always, the most important and powerful tool are consumer stories, and stories from small business owners, stories from individuals. We encourage people to submit their stories. Call us. We have, info@universalhealthct.org. If any of your listeners have a story that they feel they, would like to share and have their policymakers know about, send us your information, or just tell us, call me, and we'll call you.
Wow.
Because those stories are very powerful.
They are.
The number of people, one of our board members is a retired nurse midwife from the Hartford area. She lives in Meriden, but her her professional life was in the Hartford area, and she tells us a story about a patient who had just didn't have coverage and had a lump in her breast and didn't attend to it and waited so long that by the time she got to her to my board member's practice, one of her breasts had actually just opened up. It's a terrifying story. And this happens. People find themselves in these situations. Folks say, "Oh, that's an aberration. That's an exaggeration." There's a young family from Fairfield County. The guy's an accountant, and early in their marriage, his wife was diagnosed with multiple sclerosis, and he's got coverage. He works for a small accounting firm, but the coverage, $22,000 a year in premiums for a family.
That's a whole other job.
For a small young family, and his wife has very high out of pocket costs.
Man, 22,000. That's a part-time job.
Well, yeah,
or full-time for some people,
and that doesn't include drugs,
and
co-pays
and everything else that goes with
deductible.
Man,
right? Yeah, so.
Well, bankruptcy, the highest, the most bankruptcy are people who are seeking medical debt, seeking to get from under medical debt. That is outrageous.
So to me, the best economic development, one of the best economic development strategies is to deal with the healthcare issue, and to deal with it in a forceful and forthright way.
Mm-hmm.
And we are the insurance state, right? Although much less so today than 20 years ago, because the companies have there are fewer companies now through mergers, and they've moved their headquarters outside of Connecticut. Anthem used to be headquartered here.
Yes.
And now they're headquartered in Indiana.
Yeah.
But
because they realized they couldn't afford to live in Connecticut.
They threatened to leave. They threatened to take their jobs. They are an important part of the economy in Connecticut. I'm not denying that. But they use their jobs as a boogeyman to prevent the kinds of reforms that need to happen.
Mm-hmm.
That really, there's enough money to be made.
I mean, they're not the only ones.
No, but there's enough money to be made and still make healthcare affordable.
Yeah.
And so we need to rethink the business model. That's what I always say.
Mm-hmm.
We need to rethink the business model for healthcare.
I like that. And I think you've got the floor. I mean, you've got legislators listening to you.
Well, some days more than others. But we do the best we can, and it's more than just what happens at the legislative office building. The public has to get educated, engaged.
Yes.
And the
yes.
public the public has to understand what's at stake
mm-hmm.
here. I mean, people do individually, but what the power of coming together as community is to bring these issues into focus, and what we can do personally, and what we can do in our local communities, and what we can do at our state level.
Yeah.
I think there's action in all those levels, and certainly nationally. But most people, it's kind of like education reform. Which could you just teach my kids?
Mm-hmm.
In healthcare, it's could I just go to the doctor and not be bankrupt?
Yes. And that's it.
And at the same time, no, it can't. It isn't going to happen. There are forces at play that interfere with those goals.
You're like, no, you're going to be sick and broke.
And we got to get, and it'll continue if we don't get involved.
Yeah, that's a good point. On that note, that's a good point. Frances, I really appreciate this conversation. You have to come back. We should make this an ongoing effort.
Gladly.
To raise this awareness and to get people to talk about this and press their legislative representatives to act on their behalf and in their best interest.
Absolutely.
I like that. Thank you.
Thank you very much.
It has been my pleasure talking to you.
May I just add the final plug
Absolutely.
for May 1st? Please, if people are interested in going up to the Capitol on May 1st, just send us an email at info@universalhealthct.org.
Yes.
And we'll be in touch, okay?
I think that's perfect. Thank you.
All right.
Thank you, Harry.
We'll keep trying.